Alright, ladies and gents, during this shift title episode, we're going to touch base on a couple commonly missed areas of charting, including admission process, education, and care plans. Alright, let's talk about admission charting first. Before we do anything, let's make sure we have a weight and height document on our patient. Start by selecting the navigator and clicking the tab that you want to chart on. I always start with acknowledging orders. This gives you the opportunity to see what orders have been placed on your new patient. Once you have reviewed those orders, you can click Next in the lower right hand corner. If you forget to add something, you can always go back by clicking Previous. Now, I know admissions could be daunting. Something that we can kind of utilize to our benefit is just the general flow of the navigator. They call it a navigator for a reason, because it kind of helps you navigate through your admission documentation. So by utilizing the directional buttons on your right hand corner, you can navigate through the next things you need to document and previous things. You can also make sure that you're reviewing previous information that's still pertinent, like allergies and medical history, as you see here in the red circle, markers reviewed, and then it'll kind of put your name and timestamp there. That way we know that you reviewed that. So one section that's commonly missed is patient belongings. Make sure you're selecting belongings that are present as well as ones that are sent home. Pay special attention to home medications. Even if you do not have home medications, you must still select none, as you would for every other area. And this right here is just kind of a general snippet that just shows you some commonly missed areas. And as you can see, like, the navigator has this general flow. That way, if you go down through there, selecting next for each individual thing, you can make sure that nothing is missed and that we've hit everything on our admission. Okay, moving right along, this is our Braden scale here. This is something that's really commonly missed in all of our admission documentation. You need to make sure that you're documenting a Braden on your patient when you admit them. Alright, so another commonly missed area is advanced directives. So most of our patients are younger, so we really don't think about this, but anybody that's over the age of 18, we need to make sure that we're documenting on this when we admit our patients. So any of your adult congenital patients that come in, you need to make sure that you're taking care of this section when you're doing your admission documentation. Alright, so another age-specific area of the admission process. So your suicide risk, you need to make sure you're assessing this on any patients that are 10 years or older. So make sure you're kind of documenting that on your patients that are that age as you work your way through the navigator. Alright, so we've moved on to education now. So first and foremost is learning assessment. So when you're doing your patient admission, make sure you're documenting a learning assessment. This kind of tells us who you're educating, whether it's a family or significant other, the barriers that you might face, any languages, and then also the route you're going to use for teaching, whether it's reading or demonstration or etc. And this also gives you a point to reference back. If you've never taken care of the patient, you need to educate them on something. Alright, so you're educating a patient for the first time and you need to figure out what things you can choose from. So you can put in NHCIP, and that'll bring you a wide range of things. You can educate them on anything from central lines to seizure education to, as you see here, failure to thrive. I mean, there's tons of things to choose from. And you can also just do like a general patient education that'll kind of give you a place to start, and you can narrow it down from there by selecting things that you're going to be covering within each little sector there. Okay, now say you've had your kid all day and you still need to document education on your child, but there's been no family present, no one to educate there. So you can still go in and document that you were unable to educate. So you pull it up just like you were going to document any education. You can select who the common learners are, and that you were unable to assess and unable to contact the person that you would typically be educating. So that still documents that you attempted to educate but were unable to. Okay, so you're getting to a point where your family has already been educated plenty about a specific topic and it's maybe no longer pertinent to your patient. So you need to make sure you're going in and resolving those, and you can simply do it by going down the right hand corner, right there where you would document, and just click the green check for resolve, and then it's out of there. Alright, so we're on care plans now. So just kind of a quick little tidbit about care plans. If you go in and you see these caution signs next to your care plan go, that means the dates for those have expired and they need to be updated. So next time you're in your patient chart and you see this, now you know what to do. Alright, so you have a patient that doesn't have any previous care plan documentation. So a quick one you can kind of use is Peds Comprehensive. It's a care plan that you can utilize for each patient, and you can kind of go in and select what applies here, and it kind of covers like a broad range of topics here. As you see, inadequate gas exchange, infection, you can kind of just pick and choose what applies to your patient. Alright, so for any of your cardiac surgery patients, they all need to have this care plan. So you'll go in and put in IP cardiac surgery, and that'll bring this up, and you'll go in and select all these things, and this shows you all the things that need to be done for your patient. Alright, so you've reached a point where you feel like that the care plan no longer applies to your patient. Like say that you initially had something for a compromised level of consciousness, and now your patient is alert and oriented. So you would kind of go in like this, instead of hitting like progressing, you would hit completed, and that would complete that care plan. Alright, so this wraps up our time together, and if you thought through this presentation, oh, this seems simple, that's because it is simple. So just kind of take your time, make sure you're going through your navigator on your admissions, make sure you're documenting your care plans, and make sure you're educating your patients. And remember, if you didn't chart it, it didn't happen.